Hey guys, in this video we'll see about valsalva manoeuvre. So valsalva manoeuvre is basically forced expiration against closed glottis, wherein the subject will close their nostrils and mouth and do forceful expiration for a duration of 15 to 20 seconds. So during this process, there will be change in heart rate and blood pressure, and accordingly there are 4 phases. Phase 1 and 2 is during the manoeuvre, and 3 and 4 is post manoeuvre. So, based on the change in heart rate, we calculate valsalva ratio, and that will give us an idea about our autonomic function. So, what are the different phases of valsalva manoeuvre? And as I said, there are 4 phases, and in each phase there will be a change in blood pressure and heart rate. So, phase 1 and 2 is during the maneuver. So, phase 1 is the onset of strain, and 2 is maintenance or continuation of strain. 3 is after post maneuver, where there is sudden release of strain, and 4 is the recovery phase. Phase 1 lasts for 1 to 2 seconds, and 2 will last for around remaining 13 to 14 seconds. Again, phase 3 immediately after the manual 1 to 2 seconds, and phase 4 is the remaining rest 1 minute, like 58 to 59 seconds. Out of these 4 phases, 2 and 4 is because of baroreflex activation, and 1 and 3 the BP and heart rate change is purely mechanical. So just to put this BP and heart rate change in the graph, here and I've drawn a graph with on x-axis there is time, and y-axis there is change in BP and heart rate. So there are 4 phases as depicted. I've written it on the top. So in phase 1, BP will raise, in 2 it falls, and in late phase it raises, in 3 BP falls, and in 4 there is overshoot of blood pressure, and then it comes back to normal. In regarding heart rate, in phase 1 the heart rate falls, and in phase 2 heart rate increases, phase 3 it maintains, and in phase 4 the heart rate falls, and then it comes back to normal. The fall in heart rate in phase 4 is happening as a reflex bradycardia. So now to see these mechanisms in detail, as I said, in phase 1, which happens during the maneuver, the initial 1 to 2 seconds where there is onset of strain. So during this onset of strain, where the chest wall muscles contract, this contraction leads to compression, external compression over the large vessels like aorta. Because of this, the blood pressure will increase and heart rate will fall, and this is purely a mechanical effect that happens during phase 1. So here you could see the BP increases and heart rate falls. In phase 2, where there is maintenance of strain that lasts for 13 to 14 seconds, where there will be continuation of the strain, and this leads to decrease in the ventricular compliance, because ventricle doesn't have much space to get filled up, so that will decrease the end diastolic volume. Apart from this, continuation of this strain will increase the pressure inside the heart chambers, and that will decrease the venous return. So both decrease in end diastolic volume and decrease in venous return. This is going to decrease the cardiac output, which will reduce the blood pressure, and this fall in BP will activate the baroreflex, which in turn will increase the BP and heart rate. So if you see in phase 2, in the early phase there is fall in BP, and in the late phase, because of activation of baroreflex, there is increase in heart rate and blood pressure. So you could see the change accordingly in the graph, where there is fall in BP initially and then rise, and heart rate also increases. So phase 3, this is post maneuver, the initial 1 to 2 seconds where there is sudden release of the strain. The sudden release of strain will stop all the external compression over the large vessels. So that will also help in decreasing the blood pressure. Apart from that, there will be decrease in the there will be pooling of blood in the pulmonary capillaries or pulmonary circulation. So in this picture you could see, because of pooling of blood in the pulmonary capillaries, the venous return to the left side of the heart will decrease. That will decrease the end-diastolic volume, and that will decrease the cardiac output, which will lead to fall in blood pressure. So in phase 3, the BP will fall, and this is purely a mechanical effect, and the heart rate will maintain at the same range, at the higher range. And in phase 4, where it's a recovery phase post maneuver, so this will last for around 58 seconds. There will be everything will resume to normal, and sudden increase in the ventricular filling. That would increase the cardiac output, which will actually lead to overshooting of blood pressure, and that increase in blood pressure will activate the baroreflex, and this activation of baroreflex will cause bradycardia, decrease in heart rate. So that's labeled as reflex bradycardia, which happens in phase 4. So here again you could see the BP will overshoot and then comes back to normal. When the BP overshoots because of activation of baroreflex, there would be bradycardia. The heart rate will fall. So that's a reflex bradycardia seen in phase 4. So in phase 4, there will be BP overshoot. That increase in BP activates baroreflex, which will lead to bradycardia and fall in heart rate. So now we have seen, as we know, 1 and 3, BP and heart rate change happening in phase 1 and 3 is purely a mechanical effect, whereas in 2 and 4 it is because of baroreflex activation. The BP heart rate change happening is because of baroreflex mechanism. So if you could observe in phase 2, the heart rate is increasing, and in phase 4 heart rate will decrease. So based on this change in heart rate, we calculate valsalva ratio. So patient will be monitored with ECG during the valsalva maneuver, and what we do is we will take the longest RR interval in phase 4 and we'll divide that value with the shortest RR interval in the phase 2. And if we take a ratio, the normal ratio should be more than or equal to 1.4. If the value is less than 1.2, then it is abnormal. So just to recap, the BP and heart rate change. So in the graph, you could see the BP change and heart rate change depicted on y-axis and time in x-axis. There are 4 phases, 1, 2, 3 and 4. 1 and 2 during maneuver, 3 and 4 post maneuver. During phase 1, BP increases and heart rate falls. In phase 2, the BP decreases in the early phase, that leads to baroreflex activation, and increases in the late phase, and heart rate will increase during the late phase. In phase 3, BP falls and heart rate just maintains at the higher range. In phase 4, there is overshooting of BP, which activates the baroreflex that decreases the heart rate, causing reflex bradycardia. So these are the changes that occurs during valsalva maneuver. So and here one important thing to be noted is the change occurring in 2 and 4 is because of baroreflex activation, based on which we calculate the valsalva ratio taking RR intervals. The longest RR interval in phase 4 by shortest RR interval in phase 2 gives valsalva ratio. Normally it should be more than 1.4,